So it started out before the First World War as a cottage hospital with 4 rooms, and it's gradually built one small piece at a time on the same site. This building is a chance for us to bring together all the acute services into the one block of purpose-built areas, which is fantastic.
The new acute services building was needed to support the ongoing needs of the community. We were under-resourced here at St George.
And the senior medical staff all agreed things had to change for our patients. The Code Red campaign, Fight for St George, was born.
In January 2016, New South Wales Government committed $277 million to the redevelopment of St George and announced that the project would be fast-tracked.
And then the first piece of soil was moved in March 2016 and the building is finished.
This is quite a large development that we've undertaken. It's 9 storeys on top of the existing emergency department. Each floor is about 3.5 Olympic swimming pools in size. We have 52 intensive care beds. We have 8 new operating theatres, which doubles the capacity at St George Hospital. We have 128 inpatient beds, which increases the capacity that this hospital has to meet the needs of this community.
For Multiplex, always the key goal is to build a project safely, also to build it within time and within budget, but also to the requirements of all of the hospital staff, patients, visitors and community who are going to occupy it.
I think from day one on this project we've set up a really collaborative kind of relationship between the key stakeholders.
We've had a lot of input right from the beginning in what we'd like and how we'd like to set it up, which has been an excellent opportunity to plan for our future.
It's so essential. If you want buy-in from the medical people, you have to get them on board from the get-go.
And for us, it was very important to get up to speed quickly with their knowledge and interpret their knowledge into the design and into the building.
The greatest challenge on this project is building in a live environment.
Constructing the acute services building on top of the existing 24-hour department ED.
We're building next to birthing suites, next to operating theatres, next to ICUs.
And that was achieved by a process of consultation with the builders and the clinical staff that I think was remarkable in how well it worked.
Some of the new features in this department are the big 75-metre square operating rooms.
They're bringing us up to date and giving us enough space to work with all the new equipment that we use nowadays.
The Green Wall was a really exciting opportunity for Multiplex to get involved with assisting with the wellbeing of intensive care patients.
We can take patients who've been in intensive care out and to get some natural sunlight, and they'll be able to look up at this most magnificent vertical garden.
We're absolutely delighted to be able to donate the Green Wall to the new ICU.
We've also got a wonderful education precinct. That includes a lovely tiered auditorium and breakout meeting rooms and a simulation room, which is state-of-the-art.
For this project, Multiplex looked at engaging with the local community through an Indigenous trainee program in which we had 11 trainees on the project and were able to offer 3 of those full-time employment in the industry.
My impression of the new building, I think it's fantastic. It's bright, it's clean, it has a nice open flow and feel about it.
It delivers improved clinical outcomes, it delivers safer clinical outcomes, it delivers a more connected hospital, a hospital with a core.
Well, this is the 4th project that Multiplex has delivered in partnership with Health Infrastructure. I think that partnership is based on trust and an understanding that we follow through on what we say we're going to do.
This building is a result of a wonderful collaboration. The clinicians have engaged with architects, project team, Multiplex, the building company, and Health Infrastructure. We've worked together, not against each other, and I think you can see the results.